Can you imagine AI being better than a primary care physician
Yeah.
in terms of diagnostic accuracy and communication skills with patients?
Hmm.
Well, that is the result from Google's new AI published in Nature. We're going to understand how they did this now.
Right.
Welcome to this deep dive where we unpack complex topics to give you a clear and thorough understanding quickly.
Yeah, good stuff.
Today, we're focusing on, well, some groundbreaking research published in Nature about a new AI system called AAE. That's AMIE, Articulate Medical Intelligence Explorer,
Right, AMI.
and how its ability to engage in diagnostic conversations stacks up against real primary care doctors. You've told us you appreciate getting to grips with intricate subjects without feeling overwhelmed, and that's precisely what we aim to do today. Dissect this study and reveal its core insights for you.
And what's really fascinating here, I think, is the central issue AMI is tackling. Think about it. So much of what leads to a correct diagnosis, it really hinges on that conversation you have with your doctor.
Totally.
The questions, the answers, the way you explain things is absolutely fundamental to getting the right care.
It's not just about, rattling off symptoms, is it? This very study points out that the patient's story, that initial history taking, can contribute a whopping 60 to 80% to the final diagnosis.
60 to 80, that's huge.
Okay, so let's start by looking at this core challenge then.
Hmm?
The sheer complexity of having a truly effective diagnostic conversation. It's not just about gathering medical facts. It involves building a connection with the patient, understanding their individual worries and needs.
Yeah, and empowering them.
Exactly, empowering them to be part of the decision-making about their health.
That's precisely where a significant problem arises, though. Even among well-trained doctors, there's a wide spectrum of communication skills.
Mhm.
Furthermore, access to clinicians who are truly masters of this nuanced diagnostic dialogue, the ability to really listen and draw out the crucial information isn't always readily available. It's a global challenge, really, of expertise and access.
So that's the problem we're facing, a big one. Now let's look at the proposed solution, AME.
Okay.
This isn't just any AI that can process language. It's a large language model, an LLM. Powerful AI trained on massive amounts of text data lets it understand and generate human-like language. And this one has been specifically optimized for taking clinical histories and engaging in these really critical diagnostic conversations.
And what's key to understand about AMI, I think, is that it's designed to understand the specific language used in medicine.
Right, the jargon.
Yeah, exactly.
Right.
And to participate in what the researchers describe as natural, diagnostically useful medical conversations. Now, consider the potential benefits for you, the listener. Maybe improved access to medical knowledge for individuals who might otherwise struggle to get it, a more consistent standard of quality in those initial medical interactions, and even a way to potentially address some of the health inequities that we know exist.
Yeah. Okay, so we have this AI, AME, built for conversation. But then we hit the next challenge, don't we? How do we actually know if it's any good?
Yeah, how do you test it?
How do you refine its abilities? And crucially, how do you evaluate it in a meaningful way for you, the patient? Just asking it medical trivia questions isn't going to cut it, right?
No, absolutely not. And this raises a really important question. What benchmarks do you even use? The researchers recognized they needed to assess a whole range of factors, stuff that goes way beyond just recalling medical knowledge.
Like what?
Well, they needed to look at things like how well AMI gathers a patient's history, how accurate it is in suggesting what might be wrong, whether its proposed treatment plans make sense, and even those crucial interpersonal aspects like, communication skills and empathy.
Because those softer skills are absolutely vital in a real-world doctor-patient interaction. And as the study points out, there's been a real gap in how we've been able to rigorously measure these conversational abilities in AI.
Yeah, a big gap.
Especially when you compare it to how we assess human physicians.
So here's the next part of the solution, really. The framework that the researchers developed to both train and then test AMI.
Okay.
They created something called a self-play-based simulated environment. Imagine Amy essentially practicing medical interviews over and over again with itself.
Wow.
Going through countless different diseases and patient scenarios and receiving automated feedback to learn and get better. It's like an intense AI-driven medical school simulation almost.
That sounds like a really efficient way to learn. And they also employed what they call an inference time chain of reasoning strategy.
Yeah.
Let's try to unpack that a little.
Okay.
Think of it like Amy showing its work step by step. Instead of just jumping to a diagnosis,
Right.
It's designed to explain its reasoning as it goes through the diagnostic process, much like a good doctor would talk through their thought process with you.
Exactly.
This not only helps it arrive at more accurate conclusions, but also makes the interaction more transparent. Seems useful.
Precisely. And to really put Amy to the test, they developed a detailed set of criteria, a rubric, that looked at both what a doctor would consider important things like thoroughness and history taking and logical diagnostic reasoning, but also what matters to you as a patient, such as clear communication and signs of empathy. Then came the really rigorous part, a randomized, double-blind study.
Okay, that sounds like a serious scientific evaluation. Tell us more about how they set that up.
Right, so it was structured like a remote objective structured clinical examination, or OSCE.
An OSC.
Yeah, an OSCE is a common way to assess clinical skills and medical training using standardized patient scenarios.
Got it.
In this study, they had 20 experienced primary care physicians go through 159 different case scenarios with validated patient actors. These are people trained to realistically simulate patients with specific conditions.
Okay.
Then AIE went through the exact same scenarios. Importantly, these scenarios were designed to represent a range of healthcare contexts coming from Canada, the UK, and India.
Wow, so it was a direct head-to-head comparison using the same challenging situations. And then who was actually evaluating these interactions?
Yeah.
To see how well both the doctors and AMIE performed.
That's a crucial point for ensuring objectivity. They had specialist physicians, experts in various medical fields review the transcripts of the consultations.
Okay, the specialists.
And they also had the patient actors themselves provide feedback on their experience interacting with both the human doctors and AME.
Ah, interesting.
So this gave them perspectives from both the clinical side and the patient experience side.
Okay, this brings us to the next big question then. Diagnostic accuracy. Can this AI actually outperform human doctors when it comes to correctly figuring out what's wrong with a patient?
Well, the findings in this area are quite remarkable, actually. According to the specialist physicians who reviewed the cases, AMA demonstrated a higher level of diagnostic accuracy compared to the primary care physicians.
Really? Higher?
Yes. They looked at both the top 1 accuracy, meaning whether the single most likely diagnosis suggested was correct, and the top 3 accuracy, whether the correct diagnosis was within the top 3 possibilities considered. And in both of these measures, AME showed better performance. So the headline here for you is this. In this rigorous comparison, an AI wasn't just a little better at diagnosing, it was significantly more accurate than experienced primary care doctors, according to specialist reviews.
Wow.
That's a potential game changer we need to unpack, isn't it?
That's a really significant finding. The study also mentions top accuracy. What does that tell us?
So think of K as the number of potential diagnoses being considered.
Okay.
The researchers found that Amy had significantly higher accuracy across all the different numbers of potential diagnoses they looked at, up to 10.
Across the board, basically.
Pretty much. And interestingly, they also observed that the human doctors didn't consistently provide a list of 10 potential diagnoses, whereas Amy did. Which suggests that Amy was not only more often correct in his leading diagnoses, but also maybe considered a broader range of possibilities.
So Amy was both more accurate and more comprehensive in its initial thinking. The study also looked at accuracy in situations where there wasn't a new concerning medical issue, right? What did they find there? Where the goal is often just to reassure the patient.
Right, the non-disease state scenarios. Even there, where the focus is often on ruling out serious conditions, Amy maintained a trend of better performance. Though the researchers did note that the number of these types of cases in the study was smaller, so, interpret with a bit of caution there.
Understood.
And when they analyzed accuracy by specific medical specialty, AMI either matched or even surpassed the primary care physicians in most areas, with particularly noticeable improvements in respiratory and internal medicine.
Okay, so these results certainly paint a compelling picture of Amy's diagnostic capabilities. But the study also delved into why Amy might be showing this level of performance, didn't it? That leads us to our next aspect, trying to understand Amy's underlying strengths.
Exactly. The researchers were curious to understand whether Amy's accuracy stemmed from a superior ability to ask the right questions and gather crucial information from the patient.
Right, the data gathering.
Or if it was more about its capacity to take the information regardless of its source and arrive at a more accurate diagnosis, the interpretation part.
Oh, okay.
So they conducted a really insightful analysis. What they did was they compared the diagnoses that Amy made based on its own patient consultations with the diagnoses diagnoses that Amy generated when it was given the transcripts of the primary care physician's consultations. So basically, they fed Amy the same information the human doctors had collected.
That's a clever way to isolate the different skills involved, isn't it? What did they discover?
Well, what they found was that Amy's diagnostic performance was very similar in both of those scenarios.
Oh, interesting.
Which suggests that while Amy was about as effective as the primary care physicians in gathering the necessary information from the patient, it was actually better at interpreting that information to reach a more accurate diagnosis.
So it's not just about asking the questions.
It seems the key thing here is what you do with the answers. That appears to be a key strength for AMIU.
That's a really critical distinction. It highlights that the AI's strength might lie more in its ability to process and synthesize complex medical information. Okay, so we talked about how accurate AMIE is, but, a huge part of being a good doctor is also about how you connect with and communicate with your patients.
Absolutely fundamental.
Which brings us to the next important area: conversation quality and the overall patient experience.
Absolutely. And the researchers evaluated this from several angles. They looked at the ratings provided by the patient actors themselves,
Right.
the assessments made by the specialist physicians, and they even used some automated techniques to analyze the conversations.
Okay, and what did the patient actors think? These are the individuals who directly interacted with both the AI and the human doctors. Their perspective seems particularly valuable here.
This is where Amy really stood out. It's quite striking. The patient actors rated Amy's consultations as significantly better across a large majority of the aspects they evaluated. Get this, 25 out of 26 different criteria.
25 out of 26.
Yeah.
Wow.
These included things that really matter to patients, like feeling at ease during the consultation, the doctor actively listening to their concerns, the clarity of explanations about their condition and potential treatments, demonstrations of empathy.
Even from the AI.
Perceived empathy, yes.
Ah.
And the overall feeling of rapport with the clinician.
Wow. That's an overwhelming endorsement from the patient perspective. What about the specialist physician's views on the quality of these interactions? Did they see it the same way?
They largely echoed the positive feedback from the patient actors, actually. The specialist also rated Amy's responses as significantly better on 30 out of 32 different measures.
Okay.
And this wasn't just about the conversational aspects. They also preferred Amy's proposed diagnoses and management plans compared to those from the primary care physicians. And again, qualities like empathy and overall communication skills were highlighted as particular strengths for AME, which is quite surprising, isn't it?
It really is.
It challenges our traditional notion of empathy being solely a human trait. It makes you wonder about mechanisms behind this perceived empathy in AI and, well, what it means for the future of human-AI interaction in sensitive areas like healthcare.
It sounds like AME wasn't just getting the diagnosis right more often. It was also somehow creating a better experience for the patient, even in this text-based interaction.
But.
There's always a but.
Right. As with any important research, it's crucial to consider the limitations and nuances that the study itself points out.
That's a critical point to always keep in mind.
Absolutely. The researchers themselves acknowledge several important limitations of their work. One of the most significant is the fact that all the consultations in the study were conducted via text chat.
Right, just typing back and forth.
Exactly. And while this allowed for a large-scale comparison and is, a common way people interact with LLMs these days,
Sure.
It's not the typical way primary care physicians conduct remote consultations, which often involve phone calls or video conferencing. So the primary care physicians might have been at a slight disadvantage, perhaps, in this less familiar format.
That makes sense.
And it raises the question, right? Given that the consultations were text-based, how might the findings differ in a real-world video or phone call setting? And what are the potential downsides we need to consider there?
That's a really important question. The dynamics of a text-based interaction are definitely different from a spoken conversation. Were there any other limitations that the researchers highlighted?
They also pointed out that this study wasn't really designed to make definitive comparisons of performance across different medical specialties or geographical locations. That wasn't the main goal.
Okay.
And they raise an interesting point about the length and structure of Amy's responses, because Amy's responses tended to be more detailed and, well, more structured than those of the doctors.
Right.
That might have influenced the perception of greater empathy. It could sort of suggest to the patient that more time and thought were invested in the response, similar to how patient satisfaction can sometimes increase when doctors spend more time with them.
That's a good point. Longer equals more caring. perhaps.
Potentially. The longer responses from Amy were seen positively here, but you do have to wonder, could there be a point where it becomes overwhelming for a patient? Too much information.
That's a good point. To consider more information isn't always better if it's not easily digestible.
Yeah.
What about the way Amy was trained, using those simulated patient dialogues? Were there any limitations associated with that approach?
Yes, definitely. While using simulated dialogues allowed them to train Amy on a huge variety of medical conditions, the researchers acknowledged that these simulations, well, they can't fully capture the richness and complexity of real-life patient interactions. The subtle cues in body language, the emotional nuances, and even practical challenges like dealing with patients who have low health literacy or who speak a different language. They did observe, for instance, that Amy encountered more difficulties in simulated interviews with patients who had limited English proficiency.
Okay, so that highlights areas for future work. So while the initial findings are incredibly promising, the researchers are very clear, aren't they, that this is still an early stage of research. There's a lot more investigation needed before an AI system like Amy could be considered for use in actual clinical settings.
Absolutely. They emphasize the critical need for further research focused squarely on ensuring the safety, reliability, effectiveness, and, crucially, the protection of patient privacy.
All essential.
And they also highlight the importance of developing methods for AI to assess its own level of certainty in a diagnosis so it knows when it's necessary to say, hold on, I need to refer this patient to a human expert.
That ability to know what it doesn't know seems vital. Okay, let's take a step back then, and maybe summarize the key insights for our listeners from this deep dive into AI.
Sure. I think the core takeaway is that AI represents a really exciting advancement in the field of conversational AI for medicine. It has demonstrated, a significant potential to outperform primary care physicians in both diagnostic accuracy, as assessed by specialists, and communication skills, as reported by patient actors, at least within the specific context of text-based consultations.
So it presents a potentially transformative solution to some of the ongoing challenges of providing accessible and high-quality initial medical consultations.
Precisely. However, and it's an important however, the researchers are also very careful to emphasize that these findings need to be interpreted with caution.
Right.
The study has its limitations, as we've discussed, and substantial further research is absolutely essential before this type of technology could be responsibly and effectively integrated into routine healthcare practice.
Understood. So considering these findings, what are the broader implications for the future of healthcare? And how might AI ultimately augment that crucial relationship between patients and their doctors in ways that we haven't fully grasped yet?
Mm.
It certainly presents a fascinating landscape to consider. If you're interested in delving even deeper into this groundbreaking research, we definitely encourage you to explore the full study published in Nature and to follow the ongoing developments in the rapidly evolving field of medical AI. Thanks for joining us for this deep dive.